probably 80% of spine surgery should not be done. And if you go through a procedure that shouldn't be done, you're at risk. I finally quit my practice in 2019 to do what I'm doing full time. And it turns out we're doing spine surgery on anxiety, and it doesn't work. It turns out most symptoms in the body are based on the body's physiology. And let me define physiology for a second. It's how your body runs. In other words, you have a car, and we turn the car on. That's, quote, the physiology of the car. The spark plugs, the timing, how it runs, etc. The body functions much more complicated, of course, but your blood pressure, your acid-base balance, your electrolytes, all these things are monitored by your body. So it's the actual way the body runs is called physiology. 90% of the symptoms in the body are from the physiology, and only 10% are structural. In medicine right now, we're working about 90% structural, and we're hurting people. So I was finally seeing 3 to 5 patients a week. Again, not Dr. Death, but not that far off, where they're having these big operations done with complications that were destroying their lives. And I just heard of one case this weekend from the East Coast. I did not see the patient personally, but 2 of my friends were trying to salvage her situation. She's 26 years old with a normal 26-year-old spine. Some surgeon decided to fuse it from her skull to her pelvis. We know that pain in the back and neck is in the muscles, the tendons, the ligaments. There's nothing in medicine, in our anatomy, any part of our training that says taking a normal spine and creating this mass of scar tissue and bone with rods in place makes any sense at all. There's no data to support even a 1-level fusion for back pain. So the success rate of a 1-level fusion for back pain is about 22%. So what a fusion is, we create a temporary bridge with screws in place to hold it still, and then the body relating bone graft, which forms a bridge of bone between the 2 vertebrae, which makes a solid piece of bone. So if the bone doesn't heal, the hardware will eventually break. So the hardware is temporary because bone will not form if there's motion. So we're very good at obtaining fusions, but remember, bone spurs, arthritis, disc degeneration, herniated disc, bulging disc, none of those are a source of pain. They've been well documented to not be a source of pain. So we're doing over $20 billion a year of spine surgery on normally aging spines. So I estimate over the last 10 years, we have over 5 million people with operations that have about a 20 to 30% success rate. So if you're one of those people that got better, great, I'm excited for you. But remember, the placebo response, which is actually a very powerful healing response, is about 20 to 40%. So this is actually worse than placebo. And if you use tools that honor the body's physiology, people heal. So this 26-year-old girl could have easily, classically done just fine and had a normal life. So now she's like a tree. She can't tilt her chin. She can't rotate her head. Her neck is welded to her pelvis. And then on top of that, in her neck, what happens is that it's called internal wound dehiscence. So it's called the fascial layer is actually pulled apart. The skin, she has a big concavity in the back of her neck. In addition, she has a web neck. So that the skin gets plastered to the spine to show like a hole in the back of her neck. There's skin that covers it, but there's no muscles or tissues over this spine. So then the tissues on the side of her neck pulled out to the side. And so the muscles are on the side of her neck, just like a web feet. But see what happened, instead of doing 1 and 2 level fusions that didn't work, I'm now seeing 8, 10, 12, 14 level fusions that don't work. The complication rate of these operations is horrendous. The success rate is 20% or less. What finally got me to quit is that I've seen patients, dozens and dozens, now actually hundreds of patients go pain-free with minimal risk, minimal cost, self-directed. So I'm watching these people go pain-free, and I'm watching people actively being hurt with spine surgery. And then the downside of a failed spine surgery is just catastrophic a lot of the time. So again, the success rate of doing a back fusion for back pain is about 22%. There's not one research paper in 60 years that says that a spine surgery works, not one. I was one of those surgeons who did fusions for back pain. I did that for 7 years. I was excited about it. I was really going to help people. And I also did not think there were alternatives. So I felt like I was the end of the line. I felt guilty if I did not do a surgery. And my success rate is a little higher than 20%. I think it's like 45%, but it wasn't very good. Then the data came out in 1993 that the success rate of a spine fusion for back pain in the state of Washington workers' comp system was 15% at 1 year and 22% at 2 years. So I stopped because no data had really been coming out. And then what happened, different instrumentation procedures came out and the volume of spine surgery went up, not down based on that data. The data shows that only 10% of surgeons are actually acknowledging the data of optimizing surgical outcomes before they do the surgery. So what happened to me right about that time that I quit doing spine fusions, I developed severe chronic pain myself. So I went into a 13-year tailspin. Some people would call it burnout. Most symptoms are based on the body's chemistry. If you're in fight or flight, your nervous system is fired up, which also includes the immune system, and so it starts destroying your tissues. There's over 30 symptoms of a fired up fight or flight nervous system. Most people feel that if you're feeling stressed out, that somehow you're inadequate, you should be tougher, etc. I mean, at least in medicine, we're taught to be tough. We tend to suppress stress. Here's the concept I come up with called dynamic healing. So when your stresses overwhelm your coping capacity or your nervous system, your body goes into fight or flight. That's what it's supposed to do because your stresses are saying danger. Your body, your brain is absorbing all the input and you develop symptoms based on your body's physiology. So what happens is you call it stresses. I'm going to use the word threat instead of the word stress, but stress isn't the problem as much as the physiological response to the stress. So the physiology is fight or flight. You're consuming resources. Your glucose levels are up because of cortisol, and you're robbing glucose from your brain cells, from your tendons, your ligaments. You're breaking down your body. So you have early degeneration. You have inflammation of the brain. Painfully obvious to me is that fight or flight response includes the immune system. So what happens is that we need fight or flight to survive. So fight or flight is a gift. The problem is when it is sustained, it starts destroying your own tissues. For over 30 years, neuroscience is extremely deep that social factors affect your immune system. Chronic stress is the problem. In other words, sustained exposure to threat physiology. I'm going to call it threat physiology. So with dynamic healing, you have your stresses or circumstances and your coping skills that create symptoms. Medicine, we're treating just the symptoms. So we haven't done anything. We've treated the symptoms, which work a little bit, but you're going home to do a difficult job or an abusive spouse or whatever, that's your stresses. In medicine now, we don't have time to talk to our patients, so we don't know your circumstances. We don't know you as a person, so we don't know your coping skills. And so you're in threat physiology, we treat symptoms, and the problem keeps going. Anxiety, depression, bipolar, obsessive compulsive disorder, and schizophrenia, by the way, are inflammatory disorder. It also turns out that Alzheimer's, Parkinson's, cardiac disease, peripheral vascular disease, hypertension, obesity are all inflammatory disorders. Autoimmune disorders are clearly inflammatory, but also cancer, etc., are all from a compromised immune system. So with dynamic healing, you get to understand the person's stresses. And I can't solve your stresses, but I can at least acknowledge that they're there. And then we can give you tools to train your brain to actually process stress differently because you can't avoid stress. That's not life. And then with your nervous system, you can increase the resiliency of it. So if your nervous system can be either calm or hyperactive, if your nervous system is hyperactive, it takes less stress to set off that fight or flight response. As you calm down the body's physiology, symptoms resolve. So you want to minimize your time in fight or flight. That's the essence of the solution. And you want to maximize your time in safety. Most of the time, we're in between. Energy in, energy out. The term for that is homeostasis. But in fight or flight, you're consuming resources. You cannot heal in fight or flight by definition. My main message is that your body is a unit. If you just picture a Boeing jet, how can you fly that jet without a computer? Can't do it. All these different things come into the computer, it gets analyzed, and the computer sends out signals to the jet to fly this jet. Same thing in your body. Your brain has eyes, ears, all these sensors throughout your body that bring in all this input, and then they make adjustments by the second or millisecond to keep you alive. Acid-base balance, your blood flow, your blood pressure, all these things are adjusted every second is how we stay alive. It's automatic. So when you're in fight or flight, your body's on high alert. My cat has the same response, but she doesn't have language. So humans use the word anxiety. So anxiety is a result of a threat, it's not the cause. Anxiety is a necessary survival tool because without it, you wouldn't survive. The species of creatures who don't pay attention to threats didn't survive. So we're survival of the fittest, but also survival of the most anxious. The sensation is intended to be so unpleasant that it forces you to take action, right? So anxiety is unpleasant, but it just reflects the state of your body's chemistry. The key issue here is that for humans, we have language that makes it more complicated and that unpleasant thoughts create the same chemical reaction as a physical threat, but humans cannot escape their thoughts, right? So that's why it creates a sustained fight or flight response. So what's even worse is that repressed unpleasant thoughts are even more of a stimulus than expressed. So every human being has this problem to some degree. We all have anxiety. It's an automatic, hardwired survival response. The unconscious brain processes about 20 million bits of information per second. The conscious brain processes 20 million versus 40. So we spend a tremendous amount of life energy trying to compensate for this unpleasant feeling. We take it personally, but it's an automatic hardwired survival response. So you might as well be talking to the hard drive of your computer. Or as my friend Bruce Lipton says, you might as well take the hood of your car, lift it up, and talk to your engine. So it's going to be there no matter what. It's extremely powerful compared to your conscious brain. The essence of the solution is you separate your identity from the survival reaction, which is intended to be amoral, unpleasant, not part of your identity, not part of who you are. It keeps you alive, but it's not your identity. Things start to change relatively quickly. So the term is dynamic healing. So we allow you to process stress more efficiently. We increase the resiliency of your nervous system, which is diet, exercise, and sleep. And then there's ways of actually directly lowering the threat physiology so you're not stuck there. So there's 3 different intervention points, and each person develops their own way of actually addressing any one of those 3 on a given moment. If you're a little bit hyper and wired, you can use some breath work to drop down the body's chemistry. I had 17 of these over 30 symptoms: migraine headaches, tinnitus or ringing in my ears, stomach issues, back pain, neck pain. I had burning in my feet. These skin rashes were popping up over my entire body. And then what happened, I went from being a fearless surgeon to crippling anxiety. I had a panic attack. Panic attack is just an autonomic nervous system flood of chemicals, adrenaline, cortisol. So your heart races, you're sweating. I thought I was going to die. And that was the first of many panic attacks over the next several years. So I went from a fearless surgeon to crippling anxiety in a day. And then I thought anxiety was psychological. So I actually went into psychotherapy to solve this thing. And it turns out it's physiological. And again, it's a complete mismatch of the unconscious versus conscious brain. And to change the unconscious brain, you have to reprogram it. You can't reason with it. It's not rational, but you can start reprogramming it. And that's a different conversation. So I had over 17 of these symptoms at the same time. And again, mental pain and physical pain are processed the same way. So as I finally by accident learned how to regulate my nervous system, again, I only figured out what I was doing later. So I sort of stumbled through all of this stuff. So I wrote a book called Back in Control, A Surgeon's Roadmap Out of Chronic Pain in 2012. The second edition was 2015. I now developed what's called the DLC Journey, the Direct Your Own Care Journey, which is a computer-based program that now acknowledges the consistent sequence that people take to learn the tools to minimize their threat physiology. Medicine is treating only the symptoms. So the term I have for medicine now, and I'm serious about this, is disintegrated medicine. Integrated medicine acknowledges your circumstances, finds out who you are, and again, doesn't fix you, but allows you to fix yourself, which you obviously did. So what you did is not out there. Modern medicine is ignoring the data. I've had several friends die of cancer. Every one of them was under extreme stress when the cancer hit. I was an expert at suppressing everything. My migraine started when I was 5. My feet started to burn when I was about 30, and my ears started to ring. So here I am at the peak of my career, nice practice, great kid, beautiful house, and I was miserable. I came out of it by accident. So again, I don't want to throw my colleagues under the bus because none of us are trained correctly. I was an enthusiastic spine surgeon. Nobody taught me otherwise. And what's disturbing to me now is that the data has been there for over 50 years about exactly what's going on. There's paper after paper after paper that says stress kills. But again, for some reason, medicine has not honored what we learned in medical school. I think it's even in high school that under stress, your body goes into fight or flight. They'll say, well, this is psychological. It is not psychological. It is physiological. So these stresses or your circumstances, I'll use the word threat again, translates into physiology, which translates into disease. And that's where you cannot control your thoughts. You cannot control most of your stresses, but you can process the stresses differently. You can increase the resiliency of your nervous system. And then there's ways of directly altering your body's physiology. So there's a sympathetic nervous system that activates you. Then the parasympathetic nervous system calms you down. So essentially, most of the parasympathetic nervous system is through the vagus nerve, which is the 10th cranial nerve. So when we say cranial nerves, these are nerves that come right off the brainstem, just below the major part of the brain. There's ways of stimulating the vagus nerve that's incredibly anti-inflammatory. So if you're activated and you're in fight or flight, as you stimulate the vagus nerve, which is anti-inflammatory, you go into safety. So in safety, there's oxytocin, dopamine, serotonin, the GABA drugs, and anti-inflammatory cytokines. So what you want to do is you want to stimulate your parasympathetic nervous system to counteract your sympathetic nervous system. So for instance, breath work, slow breathing, alternate nostril breathing, slow breaths in, breaths out, directly stimulates the vagus nerve. Humming stimulates the 7th cranial nerve at the back of your throat, which is next to the vagus nerve. So humming directly is anti-inflammatory. Rubbing your forehead stimulates the 5th cranial nerve, again, the vagus nerve. And so what you're doing when you're doing these tools, you're directly stimulating the vagus nerve, which is directly lowering the threat response. I call it the output. So what you're doing with mindfulness, and I have one tool myself called active meditation, is that you have these racing thoughts, you're upset, you're wired. So what you're doing with mindfulness, you're switching your sensory input from thoughts to a different sensation.